Good.
Action.
All right. Hello, nurse. I'm just about to get ready to go visit Sally in room 102. Is she all good to get started on her physical therapy appointment? Yep. How's she been doing? Pretty good? Yep, I'm excited to get started on her. I know she's been in bed for a while. Has she had any complications that you want me to worry about or take a look at for you? No? Okay, great. Has she taken her medications today? Yeah? Alright. Any of those gonna cause her like potentially like nausea or something like that can influence my my PT visit with her today? Potentially? Okay, I'll keep an eye out on that. And her vitals have been looking good though? Yeah? Okay. Alright, I think I'm gonna get started with her. I'm gonna go visit her right now. Sally?
Hello.
Hello, I'm gonna come in here. I'm Joshua. I'm gonna be your student physical therapist that's gonna be working with you. So how are you doing today?
I'm doing alright.
Doing good? Okay, before we get started, can I just get your name and date of birth just to make sure I'm in the right room?
Yes, Sally Sands, January 7th, 1942.
Okay, nice. And then can I see that wristband? Alright, perfect. That adds up. So you're a few weeks out from your surgery. How you feeling with your hip?
Doing okay.
You a little antsy to get up and start walking?
Yeah, I want to get out of here.
Okay, that's good. We're gonna do just that today. We're gonna practice walking. I brought this walker here. First we'll do an exercise, but we'll get out in a second.
Okay.
Yeah. So I wanted to get started with let me actually wash my hands first. I want to get started with some exercises. Just give you some to do, and we'll build up some more strength of your left leg. Make sure that you heal the best way possible, and then you're back to the way you were before you came to the hospital.
Okay, sounds good.
All right. So the first, we're not going to do a full evaluation and treatment today, just because it's your first day and you might get tired. But the first thing that we're going to do is glute bridges.
Okay.
Have you ever heard of those?
Mm-mm.
No? Okay. So, do you mind if I show you or help
Yeah,
show
go
you?
for
We can
it.
take.
Yeah.
Can we take this off as well?
Yeah.
Yeah. Okay. And then before I start the exercise, do you mind if I put my hands on your legs
That's
or
fine.
anywhere?
That's fine.
That's fine. Okay, great. Thank you. All right. Keep this down as well. Do you mind bending your legs up for me? Thank you. That's perfect. And keep this catheter from moving out the way. All these wires. All right. So basically from this position, what I want you to do is to push through both of your heels and to lift your midsection up. So like lift your hips up.
Like
So-
this?
Perfect. That's great. And then you can just stay up there and then go back down. So then let's do that one more time. I don't need to help you at all. That looks great. How hard does that feel?
It feels pretty moderate.
Pretty moderate?
Yeah.
Are you in any pain doing this?
No.
Okay, that's great. Can we do, let's see, 8 of those?
Yeah.
Okay. These are looking really good. So this is going to be really functional for you in your everyday life. You know, our glutes are our biggest muscle and they're our strongest muscle, and we use them a lot. You know, kind of something like this to move side to side in our bed, and definitely while walking. We use it all the time to just get us forward, and eventually when we get you back healthy to squat down to get to something, or squat up to get up from a chair, these will be really important in your strength.
Awesome.
And that looked like a great set. So we can do those twice a day. We can do maybe 3 sets of them. So like you can do 8 3 times if you want. All right, but we're gonna get you up from this table now. We're gonna get you started on the walking.
Okay.
How does that sound?
That sounds good.
All right. So what I want you to do is we're gonna roll over to your side onto your right, and then from there I'll help you bring you up and get seated on the edge of the bed.
Okay.
Before we get that, let's get all these wires in the right way. All right. Perfect from here. So if you want to reach with your left hand and grab the handlebar right here, and then well, on 3 you can just roll over and bring your knees and shoulders at the same time. All right. Perfect. That's perfect right there. All right. This next part, I'm gonna have you have your legs fall off the edge of the table. So if you want to bring them towards the edge, and this will be totally fine. You're not going to be hurting your leg or anything like that. Don't have to worry about that. So you'll, at the same time, you'll let this leg fall and you'll push up off with this arm.
Okay.
And I'm going to help bring you up here. All right. I'll leave it here, and then we'll go up 1, 2, and 3. All right, that was great. Now, next thing we're gonna do is we're gonna lower you down so your feet can be flat on the ground and you're not, really high up.
Okay.
Let's get both those feet on the ground. All right, that's the lowest it's gonna go. That's great. And then we're gonna get this gait belt around you.
Okay.
We just have this around every patient when we have them do walking for the first time after surgeries. It's just precautionary, just in case, your leg gives out. I don't think that'll happen with you, but it's just precautionary. We always do it for our patients here at the hospital.
Okay.
All right, you mind lifting that arm up for me? All right.
This is a little tangy.
All right, and get that through. Thank you. Is that too tight for you? Shouldn't be hurting you or restricting your breathing or anything like that. Does that feel right?
That feels good.
All right, you might have to readjust it when we stand, but that feels good for me. All right, let's see. Can we scoot to the edge of the table here? All right, that looks great. All right, I'm gonna get this walker for you. And it looks like it might be a little tall for you. So before we get anything, let's lower this. All right. Let's get this over here and get this around. And your vitals still look pretty good over there before we get started. All right. So what I want you to do is you can straighten this left leg out to not put all your weight on it. And we're gonna really push with this right leg just when we get started. But when we walk, we'll put weight on both of them.
Okay.
So what I want you to do is push off of this left hand on there, right there, and then you can grab this walker right here. And then on the count of 3, you're gonna lean forward, and then you'll push through all those points, so your legs and your hands.
Okay.
All right, you ready?
Yeah.
3, 2, 1. That was great. All right. You're looking really, really good there. Can you stand up tall for me and look up straight? Let's bring this, can you bring the walker forward a little bit? Okay, your arms look like this is a good height for you. All right, let's get walking this way. So what I want you to do is put the walker in front of you, and then use that left leg that you just had the surgery on, and bring it forward, and then match it with the right. Perfect. But before, actually, can you wait right there for me?
Yeah.
Let's just unattach this from the bed and get this onto your walker right here. All right. Now let's do that gait pattern. So we're gonna bring the walker first, and then the hand, or the foot, sorry, and then the right foot. All right, perfect. Now let's do that. Let's go out here in the hallway, and we're gonna walk around over here. These are looking like great steps. How are you feeling?
Feeling all right.
Feeling good?
Yeah. Feels
Not
good.
tired at all?
Yeah.
All right. No nausea or anything?
No.
No? Okay, I think we'll just go to this chair right here, and then we'll turn around. Do you think you can go all the way, or do you want a break right here?
I think I can go.
Okay, so let's turn around right here. Great. And you look really good. I might try a different walking pattern. Do you mind stopping for me for a second? So what I want you to do now, instead of bringing the walker first and then your leg, can we do left leg and walker at the same time, and then the right leg will match?
Okay.
That looks great. You're doing great, Sally.
Thank you.
We're gonna have you back in the Olympics in no time. Ready to you're doing great. We're just gonna go back to the bed right here and we're gonna take a rest. That was really good walking for today. Can you give me a second? Just stand right there. Let's see, let's raise this table for you. That way you don't have to go all the way down to basically the ground. We'll go right there. That should be good. All right, let's back up until where our back of the knees hit the table. And then we're just gonna do the inverse of what we did right there. We're gonna have you, put that right arm back and then put the left leg forward and straighten it and then just sit back down. Perfect. All right, that was great, Sally.
Thank you.
Yes. I'm gonna take this walker away before I'm gonna get this catheter off, hook it back up, get this walker back, then I'll take this gate belt off. You mind if I go right here? That was really good walking today. How do you feel?
I feel good.
You feel good?
Yeah.
All right, you feel like you're ready to get back to bed?
Mm-hmm.
Yeah, you did great work. So your vitals still look very good. Let's get you back into bed. So we're just going to do the same thing as we did before. I'm going to have you bring your right arm right there perfectly, and this left arm is going to go over and go right on the same spot. And then we're going to lay down, put our head there. And before, let me put the bed up a little bit. That way I can help you lift up your legs. And then we're going to lift up at the same time as we fall and put our head onto the pillow. We're going to lift these legs up and we're going to put them right here. All right, you ready for that?
Yeah.
All right, ready? 3, 2, 1. That was great. All right, and then now we're just gonna roll over and get you back laying with your face up. Perfect. That was great. Let's get this blanket back on you.
Thank you.
Sometimes it's a little chilly in here, huh?
Yeah.
All right. That was really good work today, Sally.
Thank you.
Still feeling good? Any pain after that?
No, I'm ready
Okay.
to sleep.
Ready to sleep though? Feeling a little tired? You worked hard. That's great.
Yeah.
All right. Well, I'm going to check in with the nurse, tell her how great you did today. We'll be back tomorrow.
All right.
All right, and then have a good one. Have a good night's rest.
Thank you. You too.
All right. All right. Nurse, she did great. Everything looks good. Vitals are still great. She was able to walk with a 3-point, modified 3-point walking pattern, and then she did a 2-point, or then did a 3-point step 2. She did great in all of her exercises and taught her bridges. So she did amazing. Good.